A very warm welcome. My name is Barkha Dutt and you're watching the Mojo story. This is a big day for India and our battle against the COVID-19 pandemic. The world's largest vaccine rollout has officially kicked out. India has 2 approved vaccines so far. The Serum Institute manufactured Oxford AstraZeneca vaccine and the Bharat Biotech manufactured Covaxin vaccine, which is in trial mode, which in simple language means that if you're getting it, you still have to fill a consent form. That said, it's a good day to remember that India produces 60% of the world's vaccines and perhaps is the one country in the world that has some experience, in fact, more than some experience of actually mass immunization programs. Many prominent people, whether it was Dr. Randeep Guleria, who heads the All India Medical Institute, or other prominent doctors, or even Adar Poonawalla himself, who has actually manufactured one of the key vaccines, lined up to lead by example, offering themselves up on camera as people who were receiving these vaccines, and we'll bring you those images in a moment from now as well. Let me now bring our very sort of special panel on this very big day. It is a big day. It is a day that perhaps many believe would not have come as quickly as it has. And let me introduce everybody one by one on the program right now. Let me go from bottom right. We have with us Dr. Satyajit Rath. Thank you so much, Dr. Rath. We have Professor Veer Chauhan. We have Sahil Deo with us, Dr. Lalit Duggal, who actually was vaccinated himself today. And we're also joined by Dr. Ravi, who also received a shot today. So welcome all to the program. We'll have more experts joining us over the course of the 60 minutes. And we'll also be taking your questions. And we'll bringing you those special images of many prominent people who lined up to lead by example and take that shot. But of course, questions persist. Many people are worried. Should they have the right to choose the vaccine they're getting? Remember, one of the vaccines still needs a consent form. So I'll start with you, if I may, Dr. Rath. The significance of this moment and what we should be looking out for as this big process starts.
Well, I must confess to being a little underwhelmed about the significance of the moment because we've seen this coming. We do, after all, have, as you pointed out, one of the world's largest vaccine manufacturing capacities in the country. And therefore, it's not surprising that we're doing this. It's good that we're doing this. How well we do this remains to be seen. All said and done, even in our largest childhood immunization program, there's many a slip between the cup and the lip. So it would amaze me if the COVID vaccination program went all smoothly without glitches, added to which is a great deal of vaccine anxiety, driven in part by the inevitable fast-track development, but in part by the avoidable controversy over the ICMR Bharat Biotech Covaxin. So we will wait and see.
Okay, just explain this to me. Today, for people who are lining up, Dr. Rath, to get vaccinated, will they have a choice in which of the vaccines they get? My understanding is no, which means that health workers who are getting inoculated today are filling a consent form if they're getting Covaxin over Covishield. Am I understanding this correctly?
That's my understanding, but Dr. Lalit Duggal and Dr. Ravi will know first-hand information about this. Yeah. But it is quite correct that the Covishield shot is being given as a, if one may use the phrase, standard emergency use approval, whereas the Covaxin shot is being given as part of what's being euphemistically somewhat called an expanded phase 3 clinical trial. And therefore the consent is required. Whether choices are actually being offered or not, I am not quite sure of on the ground.
Okay, let me start with both Dr. Duggal and Dr. Ravi, both of whom were inoculated today. I'll start with you, Dr. Duggal. Tell us a little bit about which vaccine did you receive? Do you even know? I mean, as a doctor, you would know, right?
Yes. I got the Covishield one, the AstraZeneca one, which is manufactured by the SII. That's the one I got, but I'm given to understand that the government hospitals in Delhi got the Covaxin, which is the Bharat Biotech one. That's the one I'm getting.
So that's your photograph of you being vaccinated. And
that's right.
There you are. And at this moment, as a doctor, can you describe the sentiment? I mean, you may not be as sort of sentimental or maudlin about it as a layperson, but I'm sure you were thinking something. If we can just go back to those pictures for a second. Go ahead, Dr. Duggal.
No. I was very overwhelmed by the whole occasion. I would say that, even though I'm a healthcare worker, but I was very
Yeah.
excited and I was actually looking forward to this. And I wanted to, if you might agree, I wanted to lead by example, so that people know that we are taking it first. So irrespective of what's going to happen. So that was my reaction to it. And the other thing which I want to tell you, Barkha, is that it was very well organized, even though ours is a private setup, but everything was done by the government people, by the so-called volunteers, very well organized. A little slow to start. I mean, those kind of hiccups are always expected, but it was very well organized, and I'm quite happy with whatever was done today.
So we've heard at the top of this program two completely countervailing responses. We have Dr. Dutt, who actually thinks that he's quite underwhelmed by this moment. We have Dr. Duggal, who's completely overwhelmed, even as a hard-nosed health worker, by this moment. Dr. Ravi, they say that the truth often lies in between extreme emotions. You were vaccinated today. I will bring up those pictures. What did you feel, and how was your experience, and which vaccine did you get?
Thank you, Barkha, for having me on the show. And I received the Covishield Serum Institute vaccine. It was at 11:30 this morning, and I've been fine. As regards the reaction, the first feeling I got was a great sense of pride. Not very often in the past has India competed with the West to make a vaccine that can be delivered in a matter of 10 months. I think this is the first, being a clinical virologist and a public health virologist. My heart was filled with a sense of pride and gratitude that I have been selected. And as Dr. Duggal said, I went on to take the vaccine because people wanted frontline scientists to come forward and show that they are not scared of taking this vaccine. It's about 5 hours. I'm fine. I went back to work after half an hour observation.
And I have to ask both of you this: are you feeling anything that is atypical? I'll start with you, Dr. Ravi. Are you feeling anything at all? Are you feeling at least what, as kids, we used to feel after a jab, which is slightly feverish, body sore? Are you feeling anything at all?
Nothing. In fact, just before the show, I was talking to my dear friend Satyajit. We recalled the days when we used to get combined typhoid cholera vaccine, so painful, and always finding an excuse to run away from the school. It's nothing like that.
Yeah, I mean, as kids, the only way we would agree to get vaccines is if we got a sort of toffee from the doctor after that. Dr. Duggal, you feeling anything? Did your body react in any way? Is it too early to sort of know? Sorry, I just need to unmute you. Go ahead, sir. Yeah.
I got it around 2 o'clock, so it's just about 2 hours. But I've got little soreness in the left arm, and maybe I was telling these guys that maybe a little headache on the left side, which could be more anxiety related than anything else.
Okay. Talk a little bit about that anxiety, because if you were feeling that anxiety, can you imagine what non-doctors are actually going to be feeling, who don't even understand, right, what all of this means?
Like I said, this is something new, and we are all veterans as far as the vaccination process is concerned. We get a shot almost every year, the influenza one, that's around September or so. But then that feeling of something new, something different getting into you, and that going through that whole process, one chamber after another before the vaccine. So all that might have got into my head. I'm a little, like people tell me, I'm a type A kind of a personality. Maybe that's it.
I think the whole bunch of us suffer from that malady of being type A personalities and being warriors. But before I go to Professor V. Chauhan, I just want to get Dr. Dutt, because it's also important, and Sahil, I'll come to you as well. It is important for the checks and balances of any country to have the optimists and then the pessimists or the underwhelmed. Why are you underwhelmed? And Dr. Dutt, are you a little bit changed in sentiment after hearing your two friends and how, in a sense, proud they're feeling? And I think there's an important point here that with all the questions, all the concerns, all the worries, the one thing India does actually know is to manufacture vaccines for the world. And I think Professor Chauhan said this on an earlier program, that sitting in Pune, we have supplied vaccines to continents such as Africa. So I do want to understand your concerns at this point, Dr. Dutt.
So, oddly enough, I am underwhelmed because I perhaps have much greater trust in India and India's capacities than my friends seem to. As I said, I am unsurprised because we have the world's largest generic vaccine manufacturing capacity. I am unsurprised because we have one of the world's largest annual, albeit spread out, universal immunization program.
Yeah.
And therefore, I am entirely unsurprised that we are doing this, number one. Number two, as both Professors Duggal and Ravi pointed out, we have been taking vaccines for a long time. This is just another vaccine. We need to get over the anxiety and treat it precisely as that. It's just another vaccine. No matter how rapid.
But it's not just another pandemic, right? It locked down our lives. I think the fatality rate is actually much less than we feared, but it locked down our lives. So it's not just another pandemic. And because it's not just another pandemic, it's not just another vaccine, Dr. Dutt.
Yes, it is. That's the distinction I'm trying to make.
Explain that to me.
So when we think about our responses to the pandemic, we are filled with anxiety. We are filled with the daily evidence of disruption of lives and livelihoods around us. Compared to that anxiety, our transferring those anxieties onto, is the vaccine okay? Should I take the vaccine? Should I not take the vaccine? Is a somewhat unreasonable stretch, is what I'm trying to point out. The vaccine is the simplest part of our response to the pandemic. There are many more complex issues in our societal and individual response to the pandemic, whether in terms of health policy or in terms of economic policy, as well as in terms of whether we follow distancing and masking policies carefully enough to be careful of our neighbors or not. The vaccine is the simplest thing. So it's the one thing that we need not to worry about at the individual level, despite all the regulatory process concerns that surround Covaxin.
Yeah, so you do have those concerns, and that takes me to, in fact, that's a question I want to ask, that if Dr. Duggal or Dr. Ravi, you were getting the Covaxin instead of the Covishield, would there have been any hesitation? Now, you're both doctors, so maybe your understanding of this is different. I'll take that to you, Dr. Ravi. Would you have said, no, I don't want to take the Covaxin, I'll come back when the Covishield is ready? Or would you have readily signed the consent form, I'll ask you, Dr. Ravi, that is in fact needed for the Covaxin? Because I was interviewing Dr. Srinath Reddy, and he said to me that people must have the right of refusal. Indians must be given the right of refusal. They should be given the right to choose between these vaccines because their approvals are not equal. Do you agree with that, Dr. Ravi?
I agree with what Dr. Srinath said, but my response would have been, if I had been given Covaxin, I would have gone ahead and wholeheartedly accepted it. That's maybe because of my background. I'm a virologist. Here is a vaccine that is the oldest technology that Covaxin has used, growing virus in large amount, inactivating it and giving it. Several such vaccines have been given. So I would not have any concerns in taking Covaxin.
And Dr. Rath, you would have refused if you were in line to take a Covaxin?
No, I wouldn't, but I would be sympathetic to people who have refused. Let me explain just for a minute. The concern about Covaxin is at the level of regulatory processes. It's not at the level of individual risk. Individually, Covaxin is safe to take, even though we don't know, even with preliminary data, whether it protects or not, because a broadly similar vaccine out of China has already shown preliminary signs of protection. The most likely expectation is that Covaxin will protect as well. It's that we have undertaken a hasty regulatory approval step at the policy level that should be a concern. But at the individual level, it isn't an issue.
Yeah, I got it. That it's not its safety that is concerning you. It is the process and the regulatory mechanisms. But well, here we are, and the vaccine is rolling out. And the questions that do remain now is: should people have the right to refusal, if they should so exercise that choice? And we'll come to that as well. But there are more basic questions coming in from our viewers, and I'll take that to Dr. Chauhan. How would Indian vaccines rate versus the mRNA vaccines, referring to the Pfizer and Moderna vaccines? Now, I'm asking you this because there is some concern that as these vaccines enter the private sector globally, you will have wealthier Indians flying abroad to take their shot. There is pressure right now from the private sector saying, let us into this you will be more efficient. Even when you kept the private sector out of COVID testing, it was much slower. Let the private sector in. So why don't we take this question, and also, Dr. Chauhan, to you, the question of the public sector versus private sector.
So as of now, all the vaccines by all over the world have been purchased only by governments. So as I speak with you, there is not a single vaccine which has not been procured by government, whether it is France, whether it is European Union, whether it is Canada. In fact, till the March or April, all production of Pfizer and Moderna has already been sold, has already been booked. So the people who think they can fly abroad and get vaccinated, they're welcome to do so. I think these are very early days for all the 5-6 vaccines. I'm seriously looking forward to 2 more vaccines. We saw Johnson & Johnson presenting their data in a very reputed journal day before yesterday. Yeah. Johnson & Johnson has already submitted their papers to FDA. The Novavax is very much on the heel. So by March, I would like to, I'd not like to, inevitably, we would see some very robust new vaccines coming up. Good news is both Johnson & Johnson and Novavax will be produced in India. Biological evidence will make Johnson & Johnson, and Novavax will be made by Serum Institute of India. So this is very, today we started vaccination. I think it's really pointless right now to ask the question. I would just, if I have a minute, Barkha, what we started today, or anybody started, US or France or Denmark, these are marathon races. These are not 800 meter or a 1500 meter or even a 5,000 meter race. I've run sufficient marathons to tell you that you have to start conserving, planning the marathon right from the very beginning. You can't afford not to plan your 44 kilometers.
So you're expecting that by March, we will have two more indigenously manufactured vaccines, indigenously developed. The Serum Institute vaccine is also manufactured in India. I think the correct word for me to use, Professor Chauhan, is developed and manufactured. Yes?
So there's a Genova vaccine which might come by June, July. There's one with Zydus, which have gone under 3. You could argue Zydus is developed in India. So you'll have a gamut of vaccines by April, May. So I make no distinction whether they are developed here or not. Let me just take off where Satyajit had left.
Yeah.
It's not a question of overwhelmed or underwhelmed. Even for Serum and for Bharat to make vaccine at the scale that they have made so quickly available and transport them is not a trivial job. It's a humongous job. Of course, we have enough experience with vaccines and so on, but this speed and the time with which this is truly breathtaking. I may not be overwhelmed, but my breath has been taken away.
Okay, and I think that's fair. I think this is a moment for all our cynicism and anxieties to doff a hat to India's scientists and to the one thing that actually I think Dr. Ravi and Dr. Duggal also made this point that you're constantly being sort of benchmarked against the West, and here you're actually competitive in your performance and your execution. But here's a question on our screen, and maybe Sahil wants to pick this up. Are the wealthy Indians going overseas? If the wealthy Indians start going overseas for their vaccines, should there be a government stipulation on this? Sahil, this is only one of the many ethical concerns that are going to arise. Other questions are going to be who should get it first? After health workers and frontline workers, who should get it first? Working population or the elderly? Should it be Aadhaar driven? Should it be driven by the app that the government has created? So many questions, and vaccine inequity is just one of them. Sahil, take that and just unmute yourself before you answer, please.
So thanks, Barkha, for having me on this. So unlike the other senior scientists on this panel, I have been working more in the background on questions around distribution and access. Right? So the first paper that we put out for the Observer Research Foundation was in July 2020, where we tried to create a scoring system of sorts of how to prioritize different sections of population, right? So I think one of the other experts answered this basically by saying that most of the vaccines would be procured by governments, thereby any private individual who is not a national of that particular country might not be able to directly be vaccinated, right? I think the story in the US is a little different, where they are now allowing private pharmacies to vaccinate even without the identity of the person who gets the vaccine, right? So I think it's again a country-specific logic, but broadly, most countries won't allow foreign nationals to get vaccinated.
Okay. What is your main concern, Sahil, on access and equity? What does your preliminary research actually tell you we should be looking out for?
So firstly, on the side of whether I'm overwhelmed or underwhelmed, I am extremely excited. I think this is great that we have reached here. Uh, the real question. So till September 2021, there were statements put out that we would vaccinate 300 million people. So there's great clarity on the first two segments. The first segment being the healthcare workers, the second segment being the frontline workers. So I think there's great clarity on that. The real question would arise with the third and the fourth segment, right? So the third segment would be people who are above the age of 50, who have certain comorbid health conditions. And the fourth segment would be population below 50 who still are vulnerable because of their health condition, right?
Sure.
So now the last data point that we really have is an extensive survey that was done in 2016, which captures data at a district level about the number of people that have hypertension, diabetes, etc. Right. So I think that's the database that would be used for this, most probably. So we have made certain estimates based on that data, which tries to predict the requirement of these vaccines at a district level in these phases, right? And we are aware that different government departments are also looking into this. So we have a couple of months by the time we need to figure this out, because the entire logistics and the warehousing depends on these numbers. So I think I hope that in the next couple of months the government puts out explicit guidance on this, right? But I would say that they are taking the necessary inputs and they seem to be on track to be doing so.
Okay, so lots of different questions about foreign nationals. In fact, someone on the screen said if someone's a European national citizen and stuck in India, will he or she be allowed to board the plane without taking the shot in the coming months? We actually don't know this at all. Another viewer writing in from the United Kingdom is saying here in the United Kingdom, there's fake news about the vaccine having beef and pork. This has caused panic here among South Asians. How is India coping with fake news? Now, I think this is such, actually, Dr. Dutt, you're amused. This is such an important question because some of the crazy things I've heard about the vaccine in the last few days, somebody was telling me that there are people who actually believe that there's a chip. And when you take the vaccine, it'll install a microchip in your body, and then you'll be, in some twisted version of contagion. You'll be tracked forever. There are all kinds of crazy, anxious rumors at this point. What is the best way to address these rumors? We've seen some of that with doctors like Dr. Ravi and, Dr. Duggal stepping up to lead by example. Do you think that the Prime Minister should be on camera taking that shot and probably co-vaccine to allay fears?
Well, I'm not sure that celebrities, prime ministerial or otherwise, taking shots is the best way of alleviating anxieties. I think transparent, credible information being put out in a variety of media modalities in consistent fashion is important. And I think what's critical there is not simply to acknowledge the strengths of the process and the instruments that are being used, but also to acknowledge the uncertainties and the limitations, and to invite the people of India to participate in the clinical trial, for example, without providing unsustainable assurances about preordained efficacy, for example. As I pointed out, I am perfectly happy to take Covaxin, even though efficacy is not even in preliminary terms. All of us would be. But the point we need to be empowered to know.
I agree. But I just wanted to jump in here and say, actually, the efficacy of none of the vaccines is right now known, right? Because
why I'm using the It's why I'm using the
takes a year
term
to actually know for
preliminary
sure.
data every time.
Yeah.
All emergency use authorizations are based on preliminary data. No phase 3 vaccine trial has been completed. It's not going to be completed. The first phase 3 clinical vaccine trial is going to be completed in a few months from today. So absolutely, yes. That's why I said not even preliminary data for Covaxin efficacy. But just invite us to participate and we will.
Okay, let's come to some of the specific questions, right? So the first question is, who should get the vaccine in the second stage? It's a question that the government is going to have to answer pretty soon. There are other questions on our live stream, but let's start with this. I'll start with you, Dr. Duggal. Who should get it? Because, you know, there are two views on this. And as someone who spent a lot of time reporting this pandemic from the ground, I found that we were an outlier country in the way that many of the mortalities were actually from the mid-50s to the early 60s age group, even the late 40s, right? So there is one view, and Kiran Shaw and others have expressed this view, that working population, the working age population might need this vaccine sooner than the elderly. It militates against how Indians think, how we culturally are wired. But actually, because the elderly are staying at home, you need to give the vaccine first to those who are actually going out to work. Dr. Duggal, what do you think?
I would agree with you. The question is that, it should actually be started with in people who are maybe around 50s, number one, who got comorbidities along with, say, diabetes, some coronary artery disease, those kind of things, number one.
Yeah.
Those who are moving about, younger population, yes, certainly. Those who are elderly, we don't know, they might have an abnormal immune response. By that, I mean late 80s and 90s. I stand corrected, but they may have an abnormal immune response. So those kind of population that's staying at home and in this age group may be subjected to the vaccine later on, may not be right now. So I would put it this way, maybe middle age, around 50s or so, those even younger with comorbidities, and maybe the real elderly one beyond 80, they could be taking the shot later on.
That is interesting that you do think that those who are post-80 could be taking the shot later on. There's another question on our screen from Vivek. With very low case mortality, and if someone is still insulated and herd immunity is beginning to set in a huge section of people, is it still required or suggested to take the vaccine? Dr. Ravi, do you want to take that, or anyone wants to jump in? I'll start with Dr. Ravi, because this is a question I think will come up again and again, so many people in India have now already had COVID. So maybe we're already at some 60%. So do we still need to take this vaccine? Dr. Chauhan, I'll just give it to you. I'll let Dr. Ravi respond and then come to you. Dr. Ravi, quickly.
I would think that taking a vaccine is individual choice. Having said that, I must say that we should understand what the vaccine is offering. The vaccine is offering protection against disease. That is the endpoint, not against infection. So let us be very clear. If I get vaccinated, it does not mean I will not get coronavirus infection.
Or that you won't be a spreader. So you may not get the disease, but you could be a spreader, just said simply. Yeah.
And if people want to avoid getting disease, especially people like me who are 65, if I get infection, data very clearly tells us that those who are above 60 are the ones who manifest moderate to severe disease. So it was my choice to take the vaccine. I think there is no force here. Yeah. I believe in data-driven action. That's how I took the vaccine.
Okay. Dr. Chauhan, do you want to jump in there? I mean, I think...
I just want to add to what Ravi said. That's absolutely right point. Also, Barkha, we are forgetting, we don't know how long the immunity, the so-called immunity or neutralizing antibody, is going to last. So if you're going to wait 5-6 months, these questions can only be answered, and those who are asking these questions should be aware of it. These vaccines are promising protection against severe disease, hospitalization, and probably saving you from death, and nothing more as of now. So therefore, waiting to see whether everybody else gets immunity, then I don't need it. I think this will be not, because we don't know how long the immunity will last. Would you need vaccination again after 6 months or not? Nobody can answer that question. But the mutants, escape mutants will be around. Nobody can answer those questions now. You just have to wait and watch. I would request everybody, if you believe in vaccination per se, if you think your neighbor should take, and then you should go ahead. If the vaccine is available, please take it. Let everybody must come forward to take the vaccine.
Okay, a lot of people wanted to react to this. Dr. Duggal, Dr. Rath, and then Sahil in that order. Dr. Duggal, go ahead. I think you were wanting to say something.
Just two quick points. Number one, like he was saying, I would probably everybody should take the vaccine. There's no question about it because of the waning immunity of the infection that one has. Number one, and it's something like flu. You know, you get a flu attack, but you still take the flu vaccine, though the strain might be different, but you're still taking it. Secondly, I just want to quote a real live incident that I just experienced this afternoon in my hospital, where a very senior doctor, she said she's not going to take the vaccine.
Oh, really?
Yeah. So we asked her why. We
Why?
asked her why, and she's the one who's actually a frontline healthcare worker. She's dealing with the coronavirus. She's been, sort of handling this. A simple reason was, which might not be true really, that I'm going to wear the mask anyway. Now that seemed very odd to me, but I couldn't argue with her.
So you could not actually convince a doctor in your hospital to take the vaccine because she thought wearing the mask would be easier.
Yeah, and the doctor who's a sort of frontline worker has been handling coronavirus for the last 6 to 7 months because she felt that she's already exposed, though we don't know her antibody status as yet. So I mean,
so there's going to be a lot of
odd.
that, and this is coming from doctors. Dr. Rath, I know you have to leave. We'll get a last word from you as we go around the panel. Go ahead on this question of whether herd immunity will come before the vaccine does. Any number of very well-educated people talk like this, by the way, right now.
So the idea of effective herd immunity is a retrospective analytical idea, not a prospective one. There is really no sound way of predicting in advance what percentage coverage will lead to effective cessation of transmission, which is really what herd immunity is. And therefore, this is a mirage that leaders across the world have been spreading around for months and months and months. We need to get over this and to stop worrying about herd immunity. Herd immunity is what we will discover we have achieved when we all fulfill our social responsibilities of distancing, masking, and taking vaccines.
Yeah,
that's
so
what we should be doing.
Just to be clear to our audience, you cannot wear the vaccine. You cannot take the vaccine and drop your mask. I think we just have to stress this again and again.
Physical distancing. You have to wear the mask. You should take the vaccine and continue the distancing and the masking. That's our social responsibility during the pandemic, particularly those of us whose livelihoods are not being affected by any of this.
Absolutely. What we're going to do at this point, Dr. Rath, is I know you have to go. Thanks for your time with us. We're going to actually keep everybody else on and also welcome to the program Dr. N.K. Ganguly, who's of course been the head of the ICMR. Welcome, sir. Just getting first reactions from you in a moment. Sahil, you wanted to add a point to whether herd immunity might come before the vaccine. We heard a very passionate response on that from Dr. Rath, but go ahead.
So I fully agree with what's being said. Just two quick things. One was we should never forget the flip-flops on the whole Sweden example, right? And how policymakers, politicians, as well as scientists have oscillated to a certain extent on that. So we should not be under the illusion of herd immunity. The second point is we are already looking at a K-shaped recovery, and certain sectors are adversely affected disastrously as compared to others. So if this vaccination program slows down and God forbid there's some kind of a second wave, we cannot even anticipate the economic effects of a potential lockdown, right? Or anything of that sort. So basically, I would just re-emphasize the need of vaccination. So, thanks.
Right. So I think that point is well taken, but I think we're still dealing with some other questions of who should be in the next round. I'll let Professor Ganguly start with that, and then Dr. Chauhan. Welcome to the program, sir. We've been talking about, of course, the significance of this moment. There have been some concerns about Covaxin, but not regarding its safety, just regarding regulatory sort of protocols. But the larger picture, the significance of this moment, how optimistic do you feel, Dr. Ganguly?
Actually, I feel optimistic in a sense that we have the neutralizing antibody and T-cell immune response as markers. And for some of the vaccines now, we have the data, like for Covishield, we have now data for around 3 months. So that's quite a bit. It has gone to a large number of population also in the various countries. So that particular part is, for that particular part, I'm optimistic. But the priorities, as you were asking, one of the major priorities is that if we really look at that, when we get herd immunity, it is a modeling which was done during HIV vaccination days, and it was thought that if you can vaccinate about 70% of the population, there will be transmission will stop. If there is
Yeah.
a 50% population, transmission will be 75%. So this was the model. So here we have to vaccinate about 600 million people in India to reach that point. We are population of
Wow.
1.3 billion. So 600 millions means about minimum 1 billion vaccine doses to be will go to the arm of the people.
1
Maximum,
billion. 1
yeah,
billion.
billion doses. So
To
that is
get
a
to that, to
simple
get to that
calculation.
magic number of 600 million, which is what, 60, 70% of the
Yeah,
population, India needs to administer 1 billion doses, because of course there are
yeah,
two
yeah,
doses of vaccines.
yeah. When
Okay.
we take 2 doses, however,
Yes.
the Johnson vaccine will be one jab vaccine. There's a huge enthusiasm around. When it comes, the things might get different. But what I want to say here, that the maximum we had vaccinated till date was 27 million children and 30 million women for two vaccines. So this particular thing brings in a huge, humongous logistic problem. At this given moment, we have gone like a dream. Supply chains have worked, the jabs have worked. Although I didn't get a jab, I'm 80-year-old, and
Why didn't you
I
get a
was
jab?
saying,
You're 80 and you didn't get a jab. Is
no,
why didn't you?
because in the hospitals also, those who are in ICU, so they are immunizing 100 people. Germany is immunizing 1,000 in a day, and many
Mhm.
other places. So we are immunizing 100%. So even in a hospital, there is a line for healthcare workers. So I am in the line. So because I am not directly in the ICU. So first is the
Sure.
ICU and others. So even
But
here there is a line. So
But
maybe
may I ask you to elaborate? I'm sure you will get your vaccine soon enough, but may I ask you to just take us back to the data, and I want Dr. Chauhan to actually respond to it. You are saying that for us to reach the level of vaccine-driven herd immunity, I don't know if I'm using this correctly, but for us to reach a comfortable level of a comfortable percentage of the Indian population being vaccinated, Professor Ganguly, 600 million doses of this vaccine have to be administered. Now, just to put this into context, the government is
1
so far
billion,
purchased.
1 billion, not 600
Oh,
million,
sorry, to reach
1 billion
600 million,
doses.
we have to administer 1 billion doses. To put this into context, so far the government has purchased 11 million doses of the Serum Institute vaccine. Therefore, Professor Ganguly, according to you, what timeline are we talking to reach this 600 million people being vaccinated?
Minimum 2 years. Minimum 2 years, because at the
Really?
moment we are injecting in places where the infrastructure is already there, like healthcare facilities. Vaccinators are there, they are trained vaccinators, the spaces are there, and systems are there, and also the AFIs, that is adverse reaction management, is also there. When we go to the communities, it will be a huge issue, but every country knows it. Even the USA, which have gone into mass vaccination, or UK, which have gone into mass vaccination, they are also thinking of 1.5 years to reach those particular levels. So we need to be patient into this. The main thing is inducing people to take a jab in their hand. That is the major thing. So communication, creating confidence
Correct.
among the communities, and being very transparent. But for any vaccine which we allow, there should be enough efficacy data, enough safety data, and enough transparency, that while we go, I will give you just one example. Like
Yes.
Sinovac, China had given to Brazil. Brazil has introduced into its community. It only protected 50%. China claimed it was 70%. So when we give vaccines, the phase 4 data will be coming in. The phase 4 data will provide that how much actually got protected. So we need to be very transparent in our data. We should have very strong DSMBs. Our regulators should set enough time, and also the phase
Okay.
4 data which come up, our data managers should be able to analyze it
Okay,
appropriately.
let me thank you. That's very interesting. And I want to go straight to Dr. Chauhan and then around the panel. So if it's going to take 2 years, that's of course assuming this current level of production and availability. But Dr. Chauhan, if you are optimistic as you are that there will be many more vaccines by March, could these timelines actually change?
So vaccine availability is one matter. Vaccine travel and distribution will be another matter. Putting jabs into people, these are all steps in it. So there are countries which have enough vaccine, for example, in US, but their dissemination of their giving vaccine have been pretty slow as of now. So Joe Biden has famously said that when he takes over, there'll be 1 million, 100 days, 100 million jabs will be given. Now let me just, there are vaccine which are promising only severe disease protection, etc., is only one of the things you are going to throw at virus. Vaccine is not going to take care of everything else. When you got vaccine, you don't go to severe disease, therefore there's no problem. So whether it takes 2 years, 3 years, or 4 years, or 6 months is not going to be my concern right now. I think we should try to procure as many shots. The key would be what Dr. Ganguly said, and Satyajit said it before, you have to keep convincing people all the time. As I said, it's a marathon race. You must convince. In the ideal world, when there is no problem with the vaccine, 15 years have taken to develop, phase 3 trials have been done, even there is vaccine hesitancy. Vaccine hesitancy is not new because of COVID has come. Vaccine hesitancy has been there forever. In Japan, for example, will tell you 50% vaccine hesitancy regardless of COVID.
But Dr. Chauhan, there's one difference, and I do want Dr. Duggal and Dr. Ravi and Sahil to respond to this as well. The one difference is that this vaccine has now become linked to the opening up of the economy, to the opening up of our lives. This, at least, we have not seen in previous pandemics, right? So what people may start feeling is this fatigue that, by the time my turn comes, God knows where we will be with this vaccine. So if the economy isn't going to open up fast, the incentive to take this vaccine actually decreases, right?
So can I just answer that quickly?
Yes.
So the economies are being opened even without vaccination by social distancing and so on. This gives you another layer of confidence, as it were, a layer of comfort. And even if you're protected for 6 months from severe disease, you raise antibodies, you get general immunization. That's the only, you'll go forward, backward. This is the pandemic will make you do that. You will move forward, you may take a step backward. You take 3 steps forward, you may take a step backward. Very difficult to predict what will happen in August or September or July. We have to keep watching. What about if the escape mutants show up and escape mutants become dominant?
Yeah.
So and those are the questions you can't answer right now.
Okay, Sahil, take that, and then Dr. Ravi. You're on mute, Sahil.
Just one thought. So basically, the nature of this pandemic, the areas that are more connected to the rest of the world have been seen to be affected more, right? So if we look at Pune district, it still leads in the number of active cases of COVID even today. So luckily for us, the areas that are affected more seem to have a better distribution and a logistics network, right? So what Professor Ganguly said is absolutely right, that reaching the interior parts of India would be very difficult for the vaccine, but so for the virus, right? So even if we look at the numbers today, the concentration has around cities and larger metros has reduced in the last few months, but still rural areas are far less affected than urban areas, right? So in a way that favors the distribution.
That's very interesting that you're saying that actually the spread of the virus and the distribution of the vaccine could actually run on parallel tracks. But I'm still a bit demotivated after hearing the timeline as has been spelt out, Dr. Ravi and Dr. Duggal, by Professor Ganguly, because it just makes you feel, frankly, because I'm not a votary of the lockdown or wasn't in any case, that God knows, how long before we get our lives back. And that feeling is going to be what de-incentivizes people from getting the vaccine. Dr. Ravi?
Thanks, Barkha. And I echo what Professor Ganguly and Dr. Chauhan and Sahil said. I just want to bring a different perspective. If there's no vaccine, what choice do we have? The choice we have is one of a behavioral change. I come from Nimhans. I can tell you,
Yeah.
behavioral change is very difficult to bring about. The way we are doing it, the way we are communicating, the way we are messaging, that's not going to help in social distancing or mask wearing. The
Yeah.
old alternative history has taught us for most viral disease, the most attractive possibility is vaccination. Yes, it is going to take time. It is not going to happen overnight. Minimum of a year and a half, as Professor Ganguly said, by the time we reach everyone. Hopefully, people will start learning the new norm. I am an optimist. I believe if we also message appropriately, look, like Dr. Duggal said, there is the senior doctor who said, "I don't want to take a vaccine. I'm comfortable
Yeah.
wearing a mask." If we can get both messages across in a positive way, that you can continue your life, you have two choices: A, vaccine; B, you continue to do this. I think that's the way forward because nothing is going to happen overnight.
All right, Dr. Duggal. Sorry. Let me just unmute you. Sorry, give me a second and go ahead. Yeah.
Yeah. Barkha, well, I think I'm more of an optimist than anybody else. And I would expect the pandemic to go on and on. I would probably expect the thing to die down and maybe just an endemic kind of a virus, something a little more
Yeah.
worrisome than the flu.
Yeah.
And added on to it, along with the vaccination drive that's going on, that will probably protect a lot of people, along with what kind of herd immunity and infections, subclinical infections, which are not going to really lead to deaths. So I personally feel it's not that 2 years of vaccination drive. Well, that's okay as far as figures are concerned. But overall, next few months or maybe by the end of the year, it's probably going to be like any ordinary infection. It's not going to be that bad a pandemic like it's being projected or it is being now. That's my gut feeling. I'm trying to just tell you that.
I'm not a doctor, but I actually agree with you.
Yeah.
We're already at an IFR that is quite manageable,
Yeah.
which doesn't take away from the importance of the vaccine, of course.
So let's take it that way rather than saying, okay, these are the figures, these are the number of people who need to be vaccinated and this and that over 2 years. So let's take it that way. And of course, the new norms are wearing masks and social distancing, and like you said, a fatigue coming in, and it's there with us doctors also. We also sort of kind of lower our guard so many times. When we meet people, you kind of forget using the mask. When I go for walks for one, I just forget the mask, and my helper tells me, "Oh, where are you going?" So, those kind of things. So that's also setting in now. And I'm sure it's going to get more and more, probably, a little more down the line. You're going to kind of forget doing all these things. So that's where the vaccination will protect you to some extent. And I think over a period of time, it's not going to be as bad as it is now. You can see the figures are going down in most of the metros, excepting maybe a few places.
Yeah,
like
I agree. I agree with you. And actually, India's data is much better than a lot of the global countries. Like, I think we have to stop and acknowledge that. I have just a couple of minutes left. I'll give Dr. Ganguly a word on what his concerns would be at this point as the vaccine rollout kicks off. Dr. Ganguly, your biggest concerns at this moment. And then Dr. Chauhan, you can wrap it up for us. Sorry, sir. I just need to unmute you. Give me half a second and then you can react. Yeah, go ahead, sir. Professor Ganguly.
We need to make it as simple as possible. I was listening to Mr. Nandan Nilekani. He was of opinion that we should use Aadhaar card rather than the COVID app. I am very bad with app, and I think there will be many people who are bad with app. The second thing, we should prioritize our 50 years and old. We need not ask them to get a certificate of comorbidity, because there where the most people die. So I will put them on a priority. And lastly, I will open up my schools. I will immunize all the teachers, because schools and colleges and universities need to open physically as soon as possible. So I will reprioritize a little bit. But as we move, at the moment, we have just protected the frontline workers and our gratitude, as well as so that the system goes moving. But I will rejig the things as we move away, and I will also private sector. I will put the vaccine. Adar said that in June he will put it in the private sector because he's sending it to Brazil. So he
Yeah.
as well can put it in private. Private, 30% vaccination in India occurs in the private sector. So I will energize the private sector so that people could buy and take the vaccine.
So these are two very interesting comments, Dr. Chauhan, from Professor Ganguly. One, rejig your thinking. Don't think elderly first, think the 50 to 60 working population, and give it to teachers and open your schools and colleges. And I think these are really important points. Schools and colleges in our country have been shut for a year. I mean, I think it's, and the digital divide that's creating, children are falling out of school. There are all kinds of things that come from this. Go ahead and wrap this up for us. Where do we go from here? What do we need to reimagine our priorities? And also his comment on the private sector.
I have 2 points, very briefly, one-liner. If the vaccines become easily more available to the government or to the private sector, I think besides the point, if the vaccines are available, we should scale up our vaccination process. And it can be, if you could do 300,000 in a day, you probably can do 400,000, 500, it's a matter of details. My major concern about the vaccines right now is what will happen to the vaccines which are just waiting to come out. How and where would you conduct phase 3 trials on these? Because it will become almost unethical to conduct a placebo trial if the vaccines are already there. So if you are, as a scientist, as a vaccine developer, my major concern would be where would Zydus, for example, or Johnson & Johnson in India would get them already. So the government or the policy makers must pay attention to very good vaccines which are waiting to come out. Take care of that. Otherwise, I think we should just watch. I still think, I agree with Ravi on this. Viruses mutate not only to necessarily hurt you or make a more strong mutant. Viruses continue to mutate also to calm down. It happens with SARS, it happens with MERS, it has happened with Spanish flu, it happens with so many viruses. But I would only urge this. We don't know which way this virus is going to go. So I would not guess that this is the way virus goes. But I'll be optimistic the virus might be kind to us in time to come and then becomes more benign than what it is right now.
Well, either way, better than guessing is to take the vaccine if you can. Stop being an anti-vaxxer, stop being a rumor monger.
Good communication, share the data, involve people, communicate all the time that this is good for you.
Okay, leaving it there, Dr. Chauhan, Dr. Duggal, Dr. Ravi, two of whom have got the shot today, Sahil and Professor Ganguly. Pleasure having you on the program. Lots of questions. We hope we've answered some of them, and we'll keep a close eye reporting from the ground on the world's largest vaccine rollout. Thank you very much for